Good evening and welcome to Cynosure Lutronic webinar on LaseMD Ultra. My name is Sandra. I'm the EPAC Clinical Education Manager at Cynosure Lutronic, and I will be your host for this evening. Prior to introducing our guest speaker for tonight, I would like to go over a few housekeeping items. If you have any questions during the webinar, please enter them via the toolbox Ask a Questions, which is located on the left side of your screen. We will have a Q&A at the end of the session. Under the Ask a Question toolbox, you can download the product brochure, and on the right side of your screen, there is an icon you can click on if you want to book a demo. Also, you will receive a survey at the end of the session. Your opinion matters to us. Please take the time to complete it. Thanks for your attention. Tonight, I have the pleasure to introduce our guest speaker, Dr. Shobhan Manoharan. Dr. Manoharan is one of Australia's leading laser dermatology, specializing in the use of energy-based devices for both medical and cosmetic dermatology. Based in Brisbane, Australia, is the medical director of Dermatology Clínicos Australia and training organization DermAid. He's the founder of Brisbane Skin and was previously the managing director of Westside Dermatology and Sweat Free Clinic. He's also the former director of training for the Australasian College of Dermatology in Queensland and consulting dermatologist for L'Oréal Paris. He has a special interest in combination treatment for laser rejuvenation, scar revision such as acne, traumatic, surgical and burns, pigmentation, and surgical and non-surgical skin cancer management. Is extensively involved in the training of dermatologists and registrars, general practitioners, pharmacists, and the general public about skin health, dermatology, and laser. Is a senior clinical lecturer at the University of Queensland. Dr. Manoharan has established himself as a national expert in medical and cosmetic dermatology and is a regular expert contributing for Vogue, Cosmopolitan, and Marie Claire. He has appeared in all Australian major television channels and radio stations and performed regular skin checks for politicians in Canberra as part of public education campaigns. Over the last 10 years of private practice, Dr. Manoharan has developed a reputation for outstanding results, an holistic approach to skin health, and has built an industry-leading team of clinicians around him. It is a pleasure to welcome Dr. Shobhan Manoharan, who is going to present on how he's using LaseMD Ultra in his practice. Thanks a lot.
Thank you, Sandra, and it's always a pleasure speaking to you. Thank you, Cynosure Lutronic, for inviting me for this webinar. It's been an absolute pleasure working with the company, and it's the devices have been outstanding over the last number of years that I've had an opportunity to work with. So thank you once again. So today I'll be speaking about LaseMD Ultra and my experience with thulium lasers in diverse skin types. So I mean, my disclosure here is that I've had the LaseMD Ultra for about 7-8 months now. So there are probably people in the, who in the viewing audience now who've actually used the device for longer periods of time. But I've used fractional 1927 lasers for almost 12 years now. And so I really have, and a number of these over time as well. So I have a fairly large and broad-based experience on these devices. And I'd just like to share with the audience my experience with the various lasers over time, why I've chosen LaseMD Ultra now, compared to all the other devices on the market, and how it really works with my practice, and how potentially it could work with yours as well. So hopefully you'll take some tips out of this. So as Sandra said, I'm based in Queensland in Australia. I always do my book for Queensland tourism. We're a beautiful, Australia is a beautiful country. Queensland in particular, we have lots of sunshine. We have lots of beaches. We have the Great Barrier Reef. There's the opportunity to go on the reef. You can go to rodeos. There's wineries. There's amazing surf, amazing beaches, outstanding wildlife. You'll see some of the greatest things that you'll ever see anywhere in the world. I'm very proud to be an Australian ambassador, having grown up in many parts of the world. But one of the downsides of what we have in Australia is all that beautiful sun, is that we have all the problems associated with sun. And this is, for instance, a very typical patient that is seen in my dermatology practice, and probably seen in many clinical practices all around the world, particularly in areas where you have certain demographic, particularly fairer skin types, lots of sun exposure. We have elastosis, we have pre-malignancies, solar keratoses, field change. We have advanced aging changes despite, probably well ahead of what their age is supposed to be. But this is very, very typical with a big group of patients that we deal with. Many of my patients are looking for an improvement overall, and many of my patients understand that solar damage or solar elastosis plays a big role with what they're presenting to a dermatologist. This is an advanced skin. Many of us would have seen this photo of extensive elastosis as a result of sun exposure on one side of the face. But that it really, I think the important thing is to realize that it's not exclusive of per particular skin type. We need to understand that you have solar related changes, and then you have intrinsic aging as well. So many patients have intrinsic aging, and many patients are looking to either improve the intrinsic aging, slow down the intrinsic aging, or they're trying to get a benefit long term in regards to how they manage their skin health. Bottom line is they're trying to stop the guy on the left becoming the guy on the right too quickly. Okay, so that's what we're all trying to do. Now, many of our patients are looking for the perfect skin, and we spend so much time talking to them that you're not going to get perfect skin, but you want the best skin that you can have, and you can have outstanding skin for your age if you do the right things. You use the right skincare, you utilize the right experience in terms of consultations with dermatologists, and then also marrying the most appropriate energy-based devices that can lead to long-term skin health. So no one has perfect skin, but we have the opportunity of providing long-term skin health. Now, it's not being facetious, but a lot of my work, as you know, or many of you know, involves quite intensive laser treatments, aggressive laser resurfacing, because that's many of my patients here in Queensland. You see these patients, deep lines and wrinkles, extensive sun damage, extensive elastosis. And what we're trying to do is we're trying to resurface skin, give them new, fresh skin, a fresh bed of tissue coming through right into the dermis, collagen and elastin remodeling, and hopefully, giving them a good end result. And we're quite proud to say that we managed to do that with some of the more intensive ablative laser resurfacing treatments. And that's what we do. That's a lot of the work that I do. And for the appropriate patient, appropriate demographic, appropriate skin type and concern, this works very well. Okay, so this is my trademark 10-year flashback. It's ablative laser resurfacing. We also use it for scar treatments as well, and we often get very good results in combination with other scar techniques. And it really is a passion. It can be very satisfying professionally to be able to do, give good scar results for patients. But the problem that we have often with these aggressive treatments are they're a big hit. We need to understand that a lot of patients will not be able to deal with this. This is a typical patient of mine. She's had a number of treatments over the years, and believe it or not, she had another one literally today, this afternoon. She had another treatment with me of a particular type of ablative laser resurfacing. But you can see it's a big impingement. And the more aggressive the treatment, or the more intensive the treatment that we have to do, the bigger the downtime. So yes, we can get good results, but the problem is patients need to be sedated, and they have 1 to 2, 3 weeks downtime, and it's a big deal. Many of you understand that most patients don't have that, or many patients don't have that. And also many demographics don't need that. It's not necessary for everyone. So that's where fractional lasers have really come into play. So what I talked about previously was fully ablative laser resurfacing. Fractional lasers basically means that instead of burning away layers of skin, you're tunneling little grids into your skin. And now if you do that in an ablative fashion with an ablative laser, you're making little grids that go all the way from the surface of the skin, the stratum corneum, down to a certain depth. That might be 3 mils, 4 mils, 5 mils, depending on the device that you use. And because you're sparing most of the skin, tunneling little grids, you can get quicker recovery time as a result. So this is a histology that you would see from something like that. So you're making a very thin, what we describe as a microthermal zone. So you're Swiss cheesing, and as a result of that, then you get new collagen and new elastin, new tissue remodeling. But even then, when you do an ablative laser, a fractional ablative laser resurfacing, you can still require a significant amount of recovery time. That might still take a week to recover. And once again, many people may not have a week to recover, or many people may not want to deal with the side effects and complications of that, which could include post-inflammatory hyperpigmentation and the downtime and redness, etc. So that's where non-ablative fractional lasers have really sort of come into the forefront of there are a number of these devices that are available. We've written a few articles over time, which we'll sort of put up on my screen as we're going, describing lasers that we use for facial aging and for scarring and for rejuvenation. And non-ablative fractional lasers come in this sort of wavelength around the 1400s, the 1550s, the 1927s, and what it basically means, these lasers are still absorbed by water. Okay, so your ablative lasers are absorbed by water. The chromophore is water. They're burning lasers, but being non-ablative fractional lasers, instead of tearing through the surface of the skin in a fairly aggressive manner, you're putting pockets of energy on the lower levels of skin. So the thulium laser, for instance, the 1927 laser, which is what we're talking about today, the LaseMD Ultra, is my favorite, absolute favorite wavelength as a non-ablative fractional laser, because it still has significant water absorption, which means you still get taken up by cellular water, but it often bypasses the stratum corneum and puts the packets of energy down below. And I'll describe that in the slides coming up. So basically what you're seeing is, like I said, with this tip on 20 millijoules on the LaseMD Ultra, your stratum corneum, or this very surface of your skin, is relatively spare. But the energy is put into the lower levels underneath that. So it's almost like an umbrella, where the stratum corneum is relatively spared, and you get this pocket of energy, pocket of heat, pocket of necrosis, and remodeling that happens just underneath it. What does that mean? Your surface is still intact. You're fractionating, so you still can have significant amount of surrounding normal skin. Your recovery time's a lot quicker, right? So short downtime, and the amazing benefit is that you can treat all skin types. So in my practice, my non-ablative fractional laser history is that we started off doing ablative fractional lasers, and then we did fractional ablative lasers, and for many years we did fractional ablative lasers, and we found that it was pretty good. We could dial it down, but even then we would still get some patients where they'd get post-inflammatory hyperpigmentation, or their recovery time was too much. And so we invested, once again, we've written a number of papers on these options in the past, and a lot of my patients have photo-damaged skin here in my demographic. But we picked up the first non-ablative fractional laser, which is of another family. And it was a very good laser. It was 1927 15 nanometer laser. And it was the first there. And we did a lot of it. We did it for, we even did it for people like myself, right? And we did it extensively, which we found quite suitable for many of our patients. So these are the sort of results we were getting. They had a small brother, another diode fractional laser, which was a little bit sort of, without speaking out of school, I think it was a little bit underpowered and wasn't really what we were looking for. We wanted results, and it was an easy unit to move around. But over time, we did the previous family of non-ablative fractional lasers for literally about 10 to 12 years. And I continued to use it. It was great devices, but it's an evolution. And that's the beauty of lasers. And all of you there who are, laser geeks like me, or, love your energy-based devices, and you read and you study and you look after patients, you don't stop still. If you stop still, you end up sitting back in 1999, or you sit back in 2005. We're in 2025, and to be honest, the best 1927 on the market now, and in my opinion, of someone who's used very, very large group of non-ablative fractional lasers, is the LaseMD Ultra. So that's where I've sort of moved. So when I set up a brand new clinic, and literally 7 months ago, I spoke to my local. I wanted a LaseMD Ultra, and I spoke to my local Cynosure counterparts here, and I said, look, you really need to help me put one of these in my clinic, and I want to open the clinic up with a LaseMD Ultra, because I didn't see a point in having an older technology while this was there. Okay, so this is a long time. Sorry, So this is one of my therapists utilizing. She has been using the previous a number of the previous 1927 devices, 1550 devices. So her technique's outstanding. She loves the LaseMD Ultra. She's my clinical manager. She finds it much more ergonomic. The results are brilliant. it's a quicker treatment, so pain relief is less of an issue for patients. Event is a long time pro with the thulium fractional laser, so you can see absolute perfect. It's much less uncomfortable for the patient than when I was doing it. She's the pro. So this is brilliant, and you know what? There's a number of things I guess we need to understand about the Ultra, and it is really the only when you talk about beams with lasers, there are certain things that are quite important, and the Ultra is the only thulium that has a top hat profile. So instead of having short, sharp areas of thermal damage, you have a broader area, but still very controlled, because you can sort of, based on how you dial up the fluence and the watts, you can sort of control the level of thermal damage. You have a broader spectrum to treat. So that's quite valuable in terms of treating extensive skin damage, but also being able to dial it up and dial it down based on skin type. It's got a great big spot size, which we love. Okay, so it does mean that it is a lot quicker to treat than, so my previous thulium lasers, and many of you might have experienced these in the past as well, and you know, you often take 45 minutes to do a face, and this is literally halved our time. So we all know that we have finite resources, we have finite staff time and room time. We're all trying to run a business. It's really literally halved my time for this treatment. In a big, busy practice like mine, that then really means that a laser that is being utilized all day, you get to double up on the revenue from that. So that's been very, very pleasing for me. Now you can get 20 watts out of this device as well. So the Ultra Pro, which is the older system, which is a great device, but it was a bit slower, and you know, it had 5 watts, and the Clear and Brilliant, not previously wasn't naming names, but it was that's a small unit that I was showing was a slow unit, and is only 0.9 watts. And the Fraxel Dual, which was what I was alluding to, was 12 watts. Plus it had a consumable as well. So in practices where you're trying to build a business, you're trying to get your ROI, where you're trying to make sure that every minute in your room counts, that adds up. So this is great. This device, you know, there's minimal consumable on this, reusable tip, and with 20 watts, you get better coverage and a quicker treatment. It's been absolutely outstanding from our end. So we touched on this earlier on. You know, the damage is done in this sweet spot, about 300, 400 microns, where, you know, all the regenerative capacities happening. But also keep in mind, you get all this, apart from keratinocyte exfoliation, you also get this great melanocyte activity or exfoliation as well, which is very, very useful when you're dealing with pigmentation problems, and particularly superficial pigment problems. Not all sorts of pigment, bear with me. So we don't use this for, you know, deep dermal pigment, for instance, or complicated dermal or complicated birthmarks, but it is outstanding for superficial pigmentation. And I'll touch on this shortly while I describe a few cases. So the applications are quite varied on the Ultra. And if you don't get any other lasers for your practice, I think you really do need to consider the Ultra as an option for a mixed demographic practice. You can use it for skin rejuvenation. You can use it for topical delivery, and this is exciting because we're doing more and more of this, and we're using more delivery agents and more molecules, and we're very excited about how that's going. Acne and pore-related conditions, they're papers, they're South Korean papers that have been written in regards to acne treatment. We haven't done a lot of acne work with the Ultra, but we will be considering it. But we certainly use it for pores, and we find that very useful as well. We use it for scars and bruising, but particularly for scars. Often with bruising, we'll combine that with a vascular laser, and my preference would be to use the Derma-V and combine that with the LaseMD Ultra, which helps, one helps the bruising, the other helps the scar. But for pigmentation, surface pigmentation, epidermal pigment, it's a very, very useful tool. And we've recently started getting into hair regrowth. So I'm not covering hair in this talk today, but hopefully my next talk will be able to cover off on what we're working on at the moment, which is a combination of LaseMD Ultra hair protocol for scalp, and combining it with some interesting topicals that we're looking at, including exosomes and platelet-rich plasma and a few other agents that might be very useful. So I'll speak to it when I see our once that first stage of our trials goes through. So melasma is something we do a lot of in my practice. We have a specialist melasma clinic with some of the best protocols in melasma that we have in Australia, and it's something that we've built over many, many years. And it is a common enough condition, and I'm sure many of you deal with it on a regular basis as well. Once again, we've written a lot of papers. We've written papers on the use. So previous to where we sit now with the consideration of energy-based devices, and this really wasn't that many years ago, but dermatologists would only treat melasma with Kligman's formula, topical formula, and various forms of fading creams. And then came along some oral agents, particularly oral tranexamic acid, and we thought that was very useful as well. But it's fairly recent, probably only the last 5 years where it's become more common, and probably 10 years where it started being talked about more openly, is the fact that there are certain lasers, particularly the thulium, for instance, that would be very useful for treating melasma in combination. So we throw the kitchen sink, we use topicals, we use orals and chemical peels and laser. Okay, so we're all about treating patients in the maximal possible avenue. So a patient like this, for instance, where she had significant melasma on her cheeks, and she had a series of laser treatments with picosecond lasers. So picosecond 755 laser at another clinic, and where she was promised that she was going to get outstanding results. And really, it's not their fault, apart from the fact that they should not promise that they'll ever get outstanding results with melasma, because it can be quite variable. But she's then been referred back to me to consider another alternative. And what we've done is we've combined, which she was already doing a certain combination of, but we've combined a topical formula, and that includes a variation of a very potent version of Kligman's, where there's a hydroquinone, there's a tretinoin, there's some antioxidant, there's a steroid, very high concentration, but at a very, very short contact period. We've combined that with oral tranexamic acid, and we've combined that with the LaseMD. And this is just off one session, okay? Now, anyone who deals with melasma on a regular basis will quantify, and you will testify that one treatment and then sort of resting on your laurels and saying it's all gone is not appropriate. Yes, it may come back. Yes, she might get a rebound. But what we're doing is now we've managed to actually get a little bit of her confidence back, because this is the first time she's managed to have any sort of improvement with the melasma. And it only works for superficial melasma. It's not for deeper melasma. So if you have a look, this is her superficial stuff right here. All very chocolatey and brown, and that's the stuff that has faded, and that's on one treatment, and she's improved further on the second. But the deeper stuff here, you can see this sort of gray and blue melasma there, gray and blue there. That's where we need to treat her a bit, and probably, sorry, there's probably a little gray and blue on that top lip. That's where the oral medications, the topical faders, and maybe then going back on a cycle of a different, picosecond laser and maybe at a different wavelength might be useful. But this has given her an outstanding improvement and a new lease of life just on that first session. And then it's about getting her onto a maintenance plan. So just to give you an idea on what we can do with it. This is one session, fractional thulium laser, okay? So significant results with her. And this is a very common situation. Sorry about the exposure on this. It is probably a little more, a little brighter here, but this is a lady I've been seeing for many years. She comes in. Previously, she was having the older thulium laser, and she now has the newer one. We treat her with medical management for her melasma, but every summer or at the end of every summer when she comes back from her holidays, she comes in to see me, and we've restarted her on the LaseMD 1927 to exfoliate this. So this is great. This is very, very routine, and let me show you how this sort of works. So if I find it very handy for other conditions as well. So this lady had a combination of melasma, and she had some acne scarring as well. And so, when we look at someone like her, we want to combine therapy. So we'll medically manage her. We'll treat the superficial melasma with a lower fluence LaseMD 4 passes there. Then we're going to treat her acne scarring with a higher fluence, a little more aggressively, maybe. And then she's got some, that it really lends itself to combination procedures. So she has some slightly deeper scarring that needs focal subcision. Subcisions are a physical release procedure of deeper acne scars. Not having any problems with the creams? Sorry. Forget them. So that's where we're releasing some of the deeper scars for her. And as we're releasing, we'll inject saline or platelet-rich plasma or other agents to try to keep the scarring up. So one of the things is it really works as a combination treatment, and we'll talk about that in some of the following slides as well. Poikiloderma savant, probably a more unique condition, type 1 to 2 skin, extensive sun exposure over time, where you get a combination vascularity, you get a combination of pigmentation and textural change as well. So they get that sort of elastosis and chicken skin type appearance. And what we're trying to do with this, we'll often combine vascular laser. So I'd use the Derma-V as the first treatment, and then we'll immediately on the same session follow that up with the LaseMD to deal with some of the pigmentation as well as the texture. And believe it or not, it probably influences some of the vascularity as well. Okay, so so apart from these conditions, many people are looking for rejuvenation. Like I said, we're really trying to stop the guy. We're trying to turn that guy on the left into the guy on the right now. And the nice thing about the Ultra, and people ask me this all the time, people say, you've got great skin. What can you do? And, if you've got skin of color, we can't do laser. But you can. There are a number of lasers you can use. And really, the Ultra is probably one of my go-to lasers for skin of color, because you can tune it. It's a non-ablative fractional laser. It's got minimal downtime. And when you do it properly, you've got the right settings and you use it for the right purposes, you can give an amazing response. It's a real freshen up. So I'll do the Ultra twice a year, for instance, and I find it very handy. So
what you're doing is 2 to 4 passes with skin type like mine. Recovery time in 24 hours to 72 hours, depending on how much energy you put into it.
And like I said, you can treat any skin type. So this is another patient of mine. He had LaseMD Ultra. He's quite busy. He's quite athletic. He spends a lot of time outdoors. He just wanted a quick little freshen up. So you can see it's minimal downtime. He literally had 24, 48 hours recovery, but he's found an improvement of the pigmentation. He's found an improvement of the overall texture of his skin, and just a clarity. And he sent me a text, which I'm sharing with you here. This is another patient. He's had a number. I know him quite well. He's actually a friend, but he gets a lot of treatments, but a lot of very low downtime treatments because he's super busy. But his concerns were pigmentation, pores, texture. You can see the oiliness of his skin has dropped, right? It's not quite as sort of greasy and shiny as it was. The pores have shrunken down. The pigmentation. It's not that I've given him a facelift, but it's given him a big freshen up with a 24, 48 hour downtime. So he's texted me and said he's had a number of treatments. He was surprised. And he didn't know what to expect, and he was, very delighted. You can see how less shiny he is, how less oily. The tone and texture and the pores have improved, and really it's very satisfying. The other thing we've been using the LaseMD Ultra for is for laser-assisted drug delivery, and this is really something I suspect will become more and more of a exciting avenue for all of our practices over the next few years. So you're basically tunneling little or creating little pockets into the skin whereby your favorite exosome or your favorite polynucleotide or topical steroid or tranexamic acid can penetrate the skin. And really, with the number of topicals and the number of injectables that are, and the new classes and the new groups that are coming in, it is so exciting to be able to deliver this both for skin and hair as well. So, this lady, for instance, we've combined So the LaseMD Ultra. I've also combined the Dermav for her, just to reduce some of her vascularity and redness with Reduran, and she feels an overall glow in her skin. She's just had a baby a few months prior. She feels much fresher, and even underneath the eyes, you can just see a new rejuvenation and life without much downtime. This is 24 hours of recovery with something like this, and it really did make a significant amount of improvement. Like I said, we're looking at treatments with low downtime to treat all demographics here, and this is my experience with this as well. But when you have more sun damage and more compromised skin, you can do things like this. You're probably all looking at that going, my technique's pretty terrible. But basically, he had, this was the pre-treatment. So we've done a low-level LaseMD treatment for him, followed it up with the application of methylaminolevulonate, let it incubate for 1 hour. So he has lots of sun damage. We're trying to deal with field change, solar keratoses, some precancerous lesions, and given an overall improvement. And then we followed it up an hour after that with, previously we would treat that at 2 or 3 hours with something like red or blue light, or often a combination, to trigger the mechanism off, and then they get inflammation. These days I'll often use the Dermav on a long pulse. How's that feeling? Something to manage? So that's very handy. And this is a patient, he's not mine. He's Dr. Will Cranwell, works with me at my practice at Dermatology Clinics Australia. He did a very similar procedure for this young gentleman. Very fair skin, type 1 skin, lots of sun damage, lots of sun exposure. We can look at all these sunspots here, precancerous lesions, not skin cancer at the moment, but you want to treat him now before it becomes skin cancer. But also you can see with the combination of ALA, aminolevulinic acid, photodynamic therapy, but combining it with a pre-treatment with LaseMD, you really get a nice result at the end of that, with recovery time being about a week where you're inflamed. Okay, so very satisfying results, very much the prototype for laser-assisted drug delivery. I think this is probably the main thing in our demographic, which sort of gave us an idea of what we could do with this in laser-assisted drug delivery. So many of you who know me know that I love combination treatments, and there's not many a time that I just use one treatment, or I use one device, or I use one technique or one injectable. I'm usually doing things in combination because that's what I like doing. I think combining things probably gives you a greater, it takes more thought, but it does lend itself to synergy and better long-term patient outcomes. So many years ago, 2012, so that's well over a decade ago, a colleague of ours, dermatologist in Sydney, Chris Kearney, wrote a paper about what he called photofacials, where you're combining intense pulse light with non-ablative fractional laser. Okay, so, and getting better results as a result of that. And ever since then, many of us have been doing that. So we stack. We'll often use lasers and often use techniques and use it in combination all in the same session. But what that does mean is you can often use lower fluences. You can often do things a bit more specifically, targeting various chromophores in the same session. So someone like this, for instance, I would use a picosecond laser. So you'd use your PicoSure and zap all the brown spots first, so the larger lesions, and then you follow it up and you do your LaseMD Ultra around the background, which will then exfoliate. So you're basically priming initially with your picosecond 755 laser, for instance. So there's various other wavelengths you can use, and then you piggyback that and exfoliate with the LaseMD Ultra. This is another young gentleman in his late 30s, early 40s, late 30s, I think, and was looking for a quick little refresh. Very, very busy young man, busy businessman. And what we did was combine vascular laser with the LaseMD Ultra. He's had a few treatments with me in the past. And once again, I love it when they send me messages like this. The treatment was so much easier and less downtime, my quickest recovery. So it really, he's had lots of Fraxel in the past, right? So the downtime, heavy downtime, etc. He found this great, excellent results and quick recovery time, and really enables him to get back to life very quickly. Another young lady, and I saw her again today, and she looks great. But this was a photo that we've taken a few weeks before, where she's seen me many years ago for acne. I treated her. She got good results. She's about to get married, and she was looking for a freshen up. So combine the Derma V, where we're targeting the vascularity, all the telangiectasia that she has, overall background rosacea, and then following that up with the LaseMD Ultra, keeping in mind that she's about to get married. She hasn't got a lot of downtime. She's studying at university. This really gives her a quick result. Consistent sort of, you can really structure a plan towards a wedding. So, we'll probably do 2 of these in the lead up to her wedding, and she's going to look absolutely amazing. We'll probably just fine tune it with a light chemical peel and the right skincare before the wedding. And she's going to be the world's most beautiful blushing bride. So, it's very, very satisfying. Now, when I showed you the LaseMD that I had done, but what you need to understand that I too had a combination procedure, and interestingly, I had this combination procedure just before I went overseas to speak at another conference. So, so the combination was actually lovely. This is the Nd:YAG setting on the Derma V. And it really just it feels like a nice amount of warmth, heating the lower levels of skin. You can do this with any skin type. It's going to help more with pores, texture, tone. But more than anything, it's really sort of getting that collagen remodeling for us. And it sits beautifully alongside the Ultra. It's sort of a dual treatment, or complete the treatment, basically, is what we say. To do that, we do combine that. So you're thinking about the Derma V 1064. It's providing heating and collagen remodeling. So the mechanism of that is heat causing collagen remodeling. What you're doing with the Ultra, this clip is similar to what you saw earlier. It's basically improving the surface texture, removing any blemishes on the surface, and giving you a more superficial remodeling. And the key point out of this is that it is suitable as a low downtime. I was on a plane literally about 30 hours after I had this done, with no issues, and I was presenting at a conference at about 48 hours after this. So it really lends itself. And keep in mind, I am skin type 5, and it's outstanding. I didn't lose my hair because of this treatment, by the way. I just let it grow out of that.
Lovely.
I also use the LaseMD for a lot of scars. So speaking to this reasonably quickly, looking at the time here, we all understand, or there is a international consensus now. All of these big names in scars, including very close friends of mine, and we know that treating scars early gives you a better outcome. So someone like and that includes all sorts of scars, whether it be acne scarring, whether it be traumatic scars, burn scars, post-surgical scars. You do get a better outcome if you address that early. Someone like this, for instance, where we're looking at some acne scarring, we're looking at an overall improvement with his scar and texture, where LaseMD is going to improve things, help some of the post-inflammatory hyperpigmentation as well, without giving him too much recovery time. Someone like this, so this is to show you how versatile it is. I've done a surgical excision, so surgical scar revision of this scar here. We've done that, which is there. And then as soon as sutures were removed, we've done 3 sessions of LaseMD Ultra spaced about a month apart to fine-tune the end result. And he's very, very happy with the end result there. So it's a great scar modulating tool. We use it for post-surgical scars, all sorts of, this is a augmentation or a breast lift scar here, and we combine the vascular laser with the 1927 thulium. We do a lot of stretch marks. It's very handy, if you have redness in a stretch mark, suck it out with a vascular laser. If you have, and then you deal with the atrophy with the thulium. Minimal downtime. This lady had some burns as a result of a procedure gone wrong at a different clinic, and we then treated her with a vascular laser and the thulium as well. So it's very, very, very satisfying when we can do that. LaseMD Ultra only, just for her scars there, which is a post-traumatic scar. It's about a series of about 4 sessions, just really softened it. I did inject a little bit of intralesional corticosteroid and 5-fluorouracil. And that's improved things. Self-harm scars can be very, very challenging. No one has a great bullet for this, but we probably had as good a result with the Ultra in combination with other techniques, including topical agents like bimatoprost to try to repigment, and it's flattened and sort of evened out his scar a little bit. It's going to hopefully improve over time, never go away completely, but it's a non-ablative fractional laser like this is really something that makes a big difference. This guy had a very, very traumatic motor vehicle accident, ended up having to have laparotomy. He's lost organs and all sorts of multiple surgeries. Over a series of treatments, both topical faders, oral tranexamic acid, for what it's worth, and I've combined the LaseMD Ultra for him. I've even used a little bit of picosecond Nd:YAG as well, but I think the bulk of the improvements probably from the Ultra. It's hard. I'm never going to get him anywhere close to 100% improvement, but hopefully if we can over time, I think that's probably at least 30% improvement between left and right. Hopefully over time, if we can improve that further, he's already happy and feels a lot better. And it's also softened the scar tissue, which is the other critical thing. You can get symptomatically better. We're heading in the right direction with someone like that. So you've heard me go on about the Ultra for almost an hour here. So what are the benefits of it? It's very versatile, as you can see. It's very tunable. You can dial it up and dial it down based on what you're dealing with. It's low downtime. We can treat areas off the face, which you can't with some of the other devices. You can treat all the skin types. It really lends itself to combination therapies. It's very delegatable. I don't think I touched on this, but I have a very large dermatology practice, and I do a lot of the heavier treatments, but we have nurses, therapists, junior consultants. We have registrars, which are dermatology trainees. And the nice thing is we can train and delegate the Ultra to the other team members. It's one of the most delegatable devices. And it's also a great maintenance device. So I can do a heavier treatment like you saw at the start, but use this as maintenance. So they can do this once or twice a year to maintain their improvements. And Brisbane, here in Brisbane, Queensland, Australia, we're very sunny all year round, and I can confidently use this device all year round. I don't have to wait for patients to get to winter to treat them, okay? So we use it post-surgery to improve the overall tone and texture. We use it as a low intensity maintenance. We use it for prophylaxis for skin as well. It's a line procedure. You might have seen this slide before. If you have, then you understand that I don't cook a lot. This is probably the best dish I ever cooked in my life. So I show it off anytime I need to show off a lunchtime procedure. But basically, this is a lunchtime procedure. You can have it at lunch. You can whack on a little bit of makeup, a tinted sunscreen, and get back to work. If you had to, most people go back to work the next day. But that truffle pasta is pretty good too, right? It's a quick treatment. You can do a full face in 20 minutes, depending on the intensity that you're looking at. So it's a real time saver, and it's a quick recovery as well. Like I said, you dial it down, it's a 24-hour recovery. You dial it up, it's a 5-day recovery. So the other thing, keep in mind, and a key takeaway point from my talk, please, it is suitable for all skin types. You can treat type 1 all the way up, okay? So we can treat all our skin types with it, and we can treat it comfortably, and that makes it a very, very versatile device with a high return on investment, regardless of where your clinic is or where you're placed. So thank you very much, Cynosure Lutronic, for inviting me to speak on this. It's been a delight to be able to use the device. It's been a delight to be able to share my experience. I have a laser academy known as Dermed, and if anyone out there is interested in advanced laser training, please reach out to me. Thank you once again, and I'm happy to take questions.
Thanks, Dr. Shobhan, for sharing your knowledge and your insight on how you use the LaseMD Ultra. We have a few questions. I think you covered a lot of questions, in fact, with your comprehensive presentation. But I found a few questions. So the first one, I'm going to push it to the screen. And there we go. How many days of downtime you have experienced for patients with LaseMD? I think you mentioned in general, it's minimum downtime, and I know it's subjective to how aggressive you are, but in average, how many days?
Yeah, on average, you're looking at about 2 to 3 days downtime. Some of the lighter settings, you can, like I said, have it done and literally go back to work either later on that day or next day. In the most extreme settings that we use here for type 1 skin with extreme sun damage and field change and sunspots, you're looking at about 5 days. But on the broad spectrum, you're looking at about 2 to 3 days downtime. And really, that also depends on what your occupation and what you do. So you're healing up like a sunburn, right? So if you're working in front of the computer, for instance, you're not doing any client contact, you don't have any face-to-face things, you might be able to go work from your computer within 24 hours. So it is so patient-friendly in terms of that, which is what makes it so popular.
Now, also discussing, treatment with LaseMD Ultra. What would be the average number of treatment? I know it's subjective again to what you're treating.
Yeah, it really does. A good point, Sandra. I think it really does come down to what you're treating. There are some patients, for instance. So I won't give you a one number, but there are some patients who've got, if we're dealing with very bad sun damage, we might just do one very heavy session and put them on and really exfoliate their skin as a result of that recovery times 5 days. And then they might do this once a year as maintenance. You have patients who have melasma, for instance, where we would do between 1 to 3 sessions. That lady that I showed you who'd failed a picosecond laser but successful in this had 2 sessions and she got a very good response. And then we get her on to maintenance with the education that she will probably need another session once things started flaring up, right? So if that became a problem again. There are patients who've got scarring that might need 6 sessions, for instance, because certain scars are a more gradual improvement. So it really depends on the condition we're treating. With experience and with guidance, you're able to, the initial consult's very important to be able to guide patients about that what's a predictable timeline with that, and that comes with experience and a little bit of guidance.
Thanks, and that led me to the next question. I know you have discussed the combination that you're doing with LaseMD and Dermovie. Do you combine LaseMD with other devices? We heard with Pico short,
Yep.
Pico.
Yeah,
lasers.
Absolutely. Lends itself beautifully to combine with other devices. So picosecond lasers, vascular lasers, like you said, the radiofrequency microneedling. If you've got a Genius, for instance, it's an outstanding thing. So if you can think about what you're dealing with and where, if you think about the chromophore and the anatomy and the physiology of what you're treating, anatomy of what you're treating, the LaseMD is going to cover a lot of superficial changes and really sort of start remodeling that lower lower level on the epidermis and high level on the dermis, and exfoliate pigment and start the remodeling process and start the rejuvenation. If you add a radiofrequency device and you can get some further depth into it, you can then optimize some further improvements, particularly if you're looking at deeper scarring or deeper lines and wrinkles. So it's about getting an understanding of where the pathology is. I always say skin is always about levels. So it's about chromophores. So, what color you're treating and what level you're treating at. Those are the 2 key things. And there was a time, probably 10 years ago, where we would split the treatments off, where you do the LaseMD on one session or a thulium laser in one session, and then you come back a couple of weeks later, you do RF microneedling, but now we know we can safely do it in the same session.
And for instance, when you combine it with RF microneedling, what is the sequence of the treatment? Do you start with RF followed by LaseMD or vice versa?
I'd usually do the LaseMD first. So anything that's a little deeper or more penetrative, you'd probably do second, because if you do the RF needling and you get serum and you get the, if there's any blood and things like that, it then gets in the way of your chromophore. You don't get the best penetration of the LaseMD that you want to. So what you do is the more superficial, less the less messy treatment first, which is the LaseMD, and then you follow it up with radiofrequency microneedling.
Thanks. Next, really good question. I know you have shown us, the treatment on darker skin tone, especially your skin, which is amazing and glowing, But what are your treatment approach and tips for treating different skin types?
So that's very important, I think, and preparation and aftercare can be absolutely vital, and it then does open the opportunity for you to use energy-based devices. I think one of the problems we had with EBDs in the past was that we were just using it on darker skin types, no prep, no aftercare, and then saying that, oh, look, you end up with complications. So yes, you can still use these devices. LaseMD certainly can. You may choose to pre-fade for a few weeks beforehand if you've got a particularly darker skin type, or if it's a patient with melasma, for instance, which is a very, very problematic, very sensitive pigmentary condition. You'd always pre-treat them for at least, it's an arbitrary number, but in my practice, we at least pre-treat them for 2 to 4 weeks beforehand with a topical tyrosinase inhibitor. If they've got fairly aggressive melasma, we might then add an oral tranexamic acid as well. And then post-treatment with darker skin types. So, once again, if you don't have melasma, then you might just pre-fade them if you think they're higher risk. But post-treatment, you bring them back more carefully. You'd emphasize the sunscreen, maybe initiating it earlier. We would get them on a topical fader quite early as well. Consider oral tranexamic acid. Catch any PIH early. So once again, less of a problem with the LaseMD. You can really sort of titrate it with the darker skin types and have minimal risk of PIH if you do it properly. But pre-treatment and aftercare, and if there's one thing I can tell you, just following your patients up more closely, you can often catch things early before it becomes a problem.
Thanks. Another question, I think you answered it, before when we discussed Genius. Potenza is similar to Genius, is a RF microneedling device. Which one is better in treating scar or in general, Potenza or LaseMD?
Depends on the depth of your scarring and the type of your scarring. So if you've got if you've got both, great, you can deal with both. Mm-hmm. If you've got more superficial scarring, if you've got scarring with pigment, for instance, I think your LaseMD is probably the direction you'd like to head. And once again, you're thinking about the color of your skin. When you look at scars, you think about the color, and you think about the contour, and you think about the depth. So three key things to think about. So if you're thinking about the color and your contour and the depth, if it's fairly surface and it's a dark scar, then your LaseMD is very versatile for that. If you're looking at Potenza is going to reach a deep, it's going to reach a deeper scar for you. And keep in mind, most patients with scars often have combination scars, so you can combine both of those, Potenza and LaseMD. Genius, Potenza, LaseMD are a great suite to have, and if I was investing, I think that's a great combination.
Thanks. Now a bit of a more clinical questions. I'll let you read it. When treating cancerous areas with MD, Ultra laser, and PDT, you combine it with DermaV 532 nanometer. Do you use DermaV as a ALA, ML activator? In what order do you do it?
Yes. So to that question, I think we had a few slides on that. We do that. And we use the order is generally they'd come in, they'd have so first of all, they have a full skin check. Second of all, they are assessed for any lesions that look more than just superficial. If there's any thickness, if there's any depth, if there's any pain, then we organize biopsies first. So we don't generally do this just on patients as a first off if there are more suspicious lesions. However, if it's field change, solar keratosis, superficial malignancies, so if the biopsy, we choose not to do biopsies, if they're all fine, then they come in, they have topical anesthetic for an hour. They will then have the LaseMD Ultra, and it's a fairly conservative, low fluent settings, and we might just do 4 passes on something like that. And we use full faces, small areas we'd use MAL, large areas we'll often use ALA. We let it incubate, usually for about 1 hour, sometimes longer if you're looking at more, patients who have more, significantly more field change, sun damage, malignancy risk. Maybe shorter a little bit if we're doing lips, for instance, can be a little more conservative and even trigger it off in half an hour. And then we let them incubate. They sit in the waiting room, in the quiet room, and then we trigger it off with the Derma-V on a 532. So we do that, and at the end of that, I tend to give them all their aftercare, apply some basic sunscreen, and we get them to go back home and have a further activation with daylight PDT as well. So they then sit at home in the back deck of the balcony and have another hour of that. So in our hands, we feel it sort of optimizes, it hits a number of different pathways there and really optimizes their end result.
Thanks for your advice. Now, I think you mentioned, in your slides, about how easy it is to delegate the Ultra. In the audience, we have also dermotherapists and nurses. And often the question is, is it a great device for beginners, especially if you are not a dermatologist? In your opinion?
Yeah, in my opinion, it's an outstanding. Well, what the question is, what's a beginner's device, and it really, it's not a bad question, but it's probably underplaying what beginner means. And a beginner can be a very experienced medical practitioner, might be someone who's beginner in a certain thing but not in another, or someone who comes from a completely different background. I think what the key thing is the Derma-V, the LaseMD Ultra is something that is very user-friendly. Okay, number one is very user-friendly and intuitive and very it's not easy to learn. I don't think you should use the term easy to learn with any of these devices, but it is something that you can get an understanding of the mechanism, the appropriate settings, the endpoints, and potential complications. I think you can learn that quickly. So I'm not underplaying the power of this device, and I'm not underplaying I think with something like the Derma-V, the LaseMD Ultra, these are all devices that need to be respected. But these are very, once you get an understanding of it, learn the theory, go through Cynosure Lutronic, get your initial training, and then stay in touch with the trainers, get in touch with trainers like us. You can really get a good outcome as a practitioner at whether you're a therapist, a nurse, a physician, you can get a great outcome.
And that's right. Education is really important, and continuing education too. Now, the last question of the night, I think it will close, our webinar. You mentioned, and obviously you use Ultra for so many indications. But if you want to choose one clinical indication for Ultra, what would it be?
I'm going to choose two because I've got the screen here. So I think it's an outstanding rejuvenation tool with low downtime. So, you know, you get an improvement of your, as I mentioned previously, tone texture, overall skin health, and a reduction of your sun damage. So that then leads to better outcomes with skin cancer and long-term skin health. And number two, because I do a lot of pigment, I think it's great for superficial melasma. So I'm going cheating, and I'm going to take two. Those and I'll stand by that. And that's what we use it for. I mean, we use it so much. This laser in my clinic starts at 7:30 in the morning, and we shut it down at 5:30 in the afternoon. And you have to book a slot. Sandra, you're going to have to bring another one into our clinic, another room, because it's so good. It just continues on.
Thanks. And another thing we haven't mentioned, he has no consumable also. That's also
I did mention it briefly.
I
did mention it briefly, but absolutely, it's no consumable compared to which was one of the issues with the previous device, and which adds up, especially if you're starting off in a practice, and you know, every consumable adds up, and you can't always pass everything on to your consumer, especially in this economic climate. The LaseMD Ultra sits nicely because you've got minimal consumable.
Thanks, Dr. Shobhan, for tonight. I could continue further, but I know it's quite late in Australia. Really say a big thank you for your time and for sharing your insight on Ultra. That's conclude our Q&A questions for the audience. Thanks for joining us today, and we are looking forward to see you next time. Good night or good evening, good morning, depends where you are located. Bye-bye.
Bye-bye. Thank you, Sandra. Thank you.
Thanks.